Can we have the first video? Okay, so we are going to now, we've seen Joshua in video, now we are going to see him live. And I met Joshua a couple of years back. And I want to say this before I go on that, please, as we are talking, as you have questions, please start writing your questions in the chat box, because during question and answer, I will take everything and I will begin to ask the facilitators or the guests the questions. So please make sure you have your questions written in the chat box. The topic for today is we are looking at micronutrients and the wellness drivers. And we are going to learn more about that from the story of Joshua. And I met Joshua a couple of years back. And when he told me his story, I was amazed at, you know, what little things can do to bring about a change. And so you saw Joshua on a wheelchair, and but is now walking and is doing very well, and he's going to tell us what he did. He was actually with me in Nigeria last year in 2019, so we'll see some of the pictures of them in Nigeria, because I was very excited about what happened. And I invited you can see Dr. Joe and Joshua with us in Nigeria. This was at Mizon during the Holistic Health Conference 2019. Can you play it? It's not moving. You can see Dr. Joe adjusting someone, and you can see him this was Lagos, Mizon, and it was fantastic. And I could not resist. As Joshua, you can see him, this was last year, standing to share his story. That's Dr. Joe. We also had them in Abuja during the Clergy Care Conference, and you will see from the Clergy Care Conference. And we are going to be having the conference again in 2021. And so please stay tuned. This was them in Clergy Care. We had a full meeting with over 70 pastors, and just to talk about health and wellness and how to, you know, better equip themselves for ministry. And so without wasting time, I would like to say, Joshua, welcome. Can you share with us your story?
Sure thing, Dr. Kuyinu. Thank you for the introduction, and thank everyone for showing up. It's an honor and a privilege to be able to be here with all of you today. So I guess kind of to give you a little bit of a preface of kind of where I started at, kind of where I was on track for, and when I was 19 years old, I ended up joining the Army. It was one of those things. It was a huge family legacy for me. My family served in every major conflict since the Revolutionary War, with the exception of Korea. And so I joined the Army, and I was enlisted for a few years. And when I was enlisted, I got this letter from West Point saying, based off of line scores on this aptitude test, we think you'd be a great fit. And a service academy, federal service academy here in the U.S. Is something that's highly sought after. In fact, my dad and my uncle both fought hard to get in and never did. So for them to reach out to me was something huge. Well, I ended up getting in, and kind of the more and more I got into West Point, the more my heart was geared towards service and uniform. I wanted to fight for others who couldn't fight for themselves. And in my senior year, as I'm prepping to go make that transition to become an officer and do another 20, 30 years, to the point where I had literally my career path down to a month. And within the Army, you can actually achieve that within fair degree of precision. And during my senior year, is November 1st, 2013, I had this random weird dizzy spell. Lasted for about 15 minutes. And in fact, one of those pictures in that video was the last picture I had that was normal me for about 4.5 years. And didn't think anything of it until the next few days. It just kind of started progressing in frequency, duration, and intensity. So basically day 5, it didn't go away. And I saw, I don't know, probably 2 or 3 doctors, different specialties. Didn't really give me a clue of what was going on until I went to a neurologist, and he admitted me for 2 weeks. I had treatments of high-dose steroids and IV immunoglobulin right off the bat without even having a diagnosis. And kind of as time goes on, I start getting more symptoms. Like 6 months later, my legs started giving out. A few more months later, I start getting this twitching and getting some of these muscle spasms, and my legs are, I'm walking with a cane and having to have a mobility aid. A year after the initial symptoms started, after going through a multitude of doctors, several misdiagnoses, the doctors at Johns Hopkins actually gave me this diagnosis of a paraneoplastic syndrome, or rare overreaction to cancer. And we rolled with that diagnosis for a couple of years. Didn't have cancer. They weren't really giving me anything to help me with my symptoms, but things kind of kept progressing, where the fatigue was just becoming really hard to function. My legs were giving out more, and so in January of 2016, I go into a wheelchair and keep trying to find solutions with some doctors. And finally that fall, I ended up getting the opportunity to go to the University of Chicago, where a neuro-oncologist was certain he knew exactly what was going on, and that it was stiff person syndrome as a variant to that paraneoplastic syndrome. So he decided he wanted to do what's called a blood plasma exchange. And I was in the hospital for about 2 weeks, had 5 of those exchanges. Everything went fairly well. For whatever reason, I had a bit of a relief for about a month and a half afterwards. But after that, I started going downhill much faster, much faster. Painful, absolutely just painful, debilitating muscle spasms. The fatigue was coming on much stronger. And so about 4 months later, the doc does these tests again for these antibodies, and it's like, oh, here's the case, and here's what it is. We're going to do these exchanges once a month. And so we started in January of 17, move on to the next one in February of 2017. And that's when the first next major milestone happens and major symptoms happen. Going through the exchange up in Chicago, and about halfway through, that was the last thing I remember. Next thing you know, I think it's some 3 or 4 hours later, I'm in the emergency department. And family members were there, told me that I had gone unresponsive and started seizing. Spent a few days in the hospital, and the doctors looked back at some of my blood tests and all that to try to figure out what was going on. And they're like, oh, it's your calcium had bottomed out. And I was like, oh, okay. So they put me on a daily over-the-counter tablet of calcium after that. And 2 weeks later, just relaxing at home, I started seizing every 2 to 5 minutes, each seizure lasting somewhere between 30 seconds and 3.5 minutes long, for about a total of about 5.5 hours. And everything that doctors would typically throw at seizures was not working, apparently. I guess the doctors were screaming, having a screaming match, and had even told the family to call everyone in because they were expecting to lose me. They were even going to put me into an induced coma. Well, as we kind of continue fast forwarding through this piece, the doctors concluded that was stress, that I just needed to relax. So they sent me to a couple docs, and a doc out in New York City and Columbia University that specializes in functional disorders. She's like, it's not the case. My neuro-oncologist in Chicago wanted to put me on rituximab, which is a type of chemo. Got a second and third opinion against that. Meanwhile, my symptoms just continue to pile on until, December of that year was that realization that my time was limited. I couldn't tell you exactly why it was, but I knew that I was not going to have much longer unless we figured out what was going on. By April of 2018, I knew it was not going to see Christmas, and it was actually March, April of that time frame where I actually had transitioned to an electric wheelchair.
And this was what year? This was 2017?
18.
2018, okay.
2018. And it had really just hit this point where I needed, 24-hour care. I'm having seizures every day, and in some cases 8 to 10. Towards the end of it, was where
about
I was really
10 seizures, about 10 seizures per day.
Correct. My diaphragm would seize up while I was conscious, and that's a special kind of pain, let me tell you. A ton of autonomic issues, and what can only be described as divine intervention. I meet Dr. Joe at a restaurant here locally in Peoria, Illinois, and I hear him, his sister, and someone on their team talking about educating, empowering doctors, and I'm like, ooh, what hospital system do you work for? I have all of the input. And they tell me they're chiropractors and kind of what they did around kind of a functional approach to healthcare, and I end up getting his information, and he requests my medical records, so I give him a 20-page synopsis of the 10,000-page record. Huge. And he was initially going to hand me off to another doc. The gal I was seeing at the time, wanted me to see him, and he was going to say, how about next month in July, because it had about 3 or 4 weeks since we first met, and it was one of those things like, no, it needed to be like soon, because I knew my time. While I had told family it was I wasn't seeing Christmas, I knew it was probably closer to August, if not sooner.
So you started feeling that you were this was getting to the end for you.
It was definitely getting to the end. My heart was doing all sorts of crazy things. The more I was out, like just even simply going to a doctor's appointment would put me down for 3 to 5 days of just having nonstop seizures. And it was pretty rough. So the first day I go see, Doc Joe, he's like, well, how about, tomorrow I go get an x-ray of my spine. And I go see him, and one of the things he comes back with when I'm sitting there with him, he's like, oh, you have a magnesium deficiency. And I'm like,
you have a magnesium deficiency.
Correct. And I'm just like, how does he come up with this? We haven't done any tests. He's just looked at records. And then he pulls up my x-ray, and then, lo and behold, my skull's sitting like that. It's sitting crooked. And my, first vertebra was compressing the brainstem. And he knows all of the, specific terminology and whatnot for that. But he gives me the first chiropractic adjustment, and then has me start taking magnesium. And first day, does the adjustment, no big deal. Second day, he does drops down, does our adjustment, and immediately I start getting super, super hot, starts sweating, really nauseated, threw up, had a seizure. And I was like, holy cow, this guy just killed me. He does an adjustment on my lower back, and he's like, all right, come back here on Friday. I'm sitting here thinking, oh boy, do I really want to go see this guy on Friday? But I do go see him. I'm still taking the magnesium in the way he told me to do. And that Sunday, so we're talking 5 days, I go to my dad's house. I'm having a lot more energy. He doesn't have a ramp, so I was having to utilize a cane although I'm falling would usually fall down every, few steps. Hot day, but I was able to get around. I only had a couple falls, but I had this energy that I couldn't explain. I go see him that Monday in an electric wheelchair again. Still feeling great. I had gone, since that past Wednesday, so about 5 days without a seizure. And I noticed that I'm able to get around the house, and I'm walking with my cane around the house. There's no issues. So I decided I'm going to go into the office, go see him that Wednesday, walking a cane. And then he asks me to do something that I thought was kind of odd. He's like, well, he's like, how do you feel? I'm like, I feel great. And he's like, well, do me a favor. I'm like, what's that? And he's like, live it. I'm like, what does that mean? He's like, just embrace it and embrace the fact that you feel better. So I'm like, okay. So first thing I did, I went to the grocery store and was able to walk around the grocery store for the first time, and I don't even know how long. And I noticed I haven't had any legs. I'm still seizure free. And then I go see him on Friday without the cane, no issues whatsoever. And then he asked me to do him another favor. And he's like, try to go for a jog this weekend. And so I did. Not a very far jog. It hurt like crazy because my body hadn't done something like that in years. But I went for a jog. Swam laps in the pool, from 6 chiropractic adjustments and about 20 grams of magnesium.
And that was it.
That 9-day time frame, and that was it.
9 days. Well, wonderful. That is. I'm still excited about your story, and I think we're going to hear. So we've heard from you on the journey and just how within 9 days, what took years, and nobody could tell you what was wrong within 9 days. Unfortunately, we actually have Dr. Joe here who worked with you. And so we are going to go back and tell me, you didn't mention how much did the military spend and how much did you spend in those 9 days?
So over the course of the 4.5 years, the 29 doctors at 11 different hospitals, roughly about $2 million spent.
Roughly about $2 million was spent and no result came.
And no result came, and I was still going to die.
And how much did you spend to get out of the wheelchair and for your seizures to go?
Let's see, for the triple mag and whatever it was, per adjustment with Dr. Joe, I can't even imagine, but it was like maybe a couple $100, something like that, compared to $2 million.
Like, I remember you saying that you spent about $250, in that 9 days. Yeah. And that reminds me of, there's a scripture that I like, which talks about what, come and eat, come without price. Why do you spend your money on that which does not satisfy? And that the blessings of God makes rich and added no sorrow. And the things that God gives is not expensive. It's not all this big machine that makes, truly God wants to heal us. And, knowledge is power. So I'm going to turn over to Dr. Joe and say, Dr. Joe, so what did you do to Joshua? How did you mess him, how did you mess him up? What did you do to Joshua to get him out of the wheelchair and to get that seizure? You messed up the seizures. What?
Well, I'll tell the story a little bit about, about what we found. And one of the things in healthcare is the questions that you ask will dictate the answers that you'll receive. So it really depends on what question your doctor is asking himself or herself in order to see how you can solve the problem. So if the question was, what drug to give Joshua, he may not have got out of the wheelchair. If they asked, what surgery can we do for Joshua, or what chemo drug should he take, he probably would not have got out of the wheelchair. So really, the body is, you have to understand, the body is a self-healing organism. It's created to be healthy. It's designed to be healthy. It's a self-regulating organism, meaning that it regulates its own temperature, its own blood pressure, its own heart rate, its digestive enzymes, hormones. It regulates itself. So it's self-healing and it's self-regulating. And if you start out with that premise, that's basically a premise, then it shapes the questions that you're going to ask. So when dealing with a natural approach to health, it's more of detective work to see what is this person missing and what can we do to help the body heal itself. It's a very different question than thinking the body's not working, it's unable to heal itself. What do I need synthetically to put in, or what broken organs do I have to take out? It's a very different theory and process, because it doesn't matter what doctor you go to. If they're all asking the same question, they're all going to get the same answer. So I'll pull open slides to kind of show you a little bit. So Dr. K asked me to speak a little bit about understanding micronutrients. And I think this is important, especially in our current state of the world in regards to this virus. Is there's so much talk about this virus, and let's say it's a strong virus. What we have to focus on is a stronger host, because you are the host. The virus is hosted by your body. So this talk can help you understand how you can be a stronger host and be able to live an empowered life through natural health. When Joshua came as a very prestigious Naval Academy graduate, one of the best management schools in the country, one of the hardest schools in America to get into or worldwide to get into, he was very intelligent. He was very organized. And he brought a chart to me of all the things that happened to him over a period of time, and when he got in the wheelchair and what he did and all these different things. And one of the things he told me, and I believe, I don't know if it's on this list, but he had told me, is he had some issues in the heart when he was young, like an arrhythmia, an imbalance of the heart. And as soon as I heard that, I know that's most of the time a magnesium deficiency. And then he tells me that he's at the hospital and they're taking his blood out and trying to clean the blood. That's what he called plasmapheresis. And basically, it's back to the mindset that the doctors think it's broken inside. We have to unbreak it. We have to, the body's not working right. We got to figure out how to make it work. And so what they did is they literally tried to wash his blood. They put a tube in and they pull his blood out, 20% of his blood, and then 20% later in the day and 20% the next day. And the goal is to clean the blood. Take all the blood out, and then they put back the cells. But they also put back calcium. The issue is he already had a magnesium deficiency, and calcium competes with magnesium. So he already had a problem, and then they put all this extra calcium in his blood, and they make his deficiency worse. So his seizure started to escalate because lack of magnesium can cause your body not to work correctly. So the things that we did was look at his spine and find misalignments. This is not Joshua, but it's an example. The spine shifts out of position and it compresses nerves in the body that control how your body functions. This is an epidemic worldwide where people have alignment issues in their spine causing sickness and disease. And it's one of the issues that we see. There's not enough doctors looking or correcting this problem. And one of my goals and Joshua's goals, Dr. K's goals, is to bring doctors to Nigeria that are trained to solve this problem. The videos that Josh didn't show you is the videos that he sent me, and that's the video, and it's a little distorted video, but this is what Josh was going through, 10 times a day, these types of seizures all day long, muscles cramping and tightening, and this is what he would be dealing with 10 times a day. So like I said, what they did is they removed the liquid, it's called the serum, and they added back calcium, which made the magnesium deficiency worse. So when you're looking at healthcare, most of the healthcare system around the world is focusing on one thing, It's a treatment of symptoms. How do we get rid of the headache? What pill or drug or therapy or surgery can I do to get rid of the headache? What pill, drug, or surgery can I give you to get rid of your back pain or your ulcer or any disease, any condition? Is the mindset is the body doesn't work. How can I make it work? I either put a synthetic chemical in, not natural because the body's broken. I have to put a synthetic man-made chemical in, which is a drug, or I got to take an organ or a tissue out because it's not working. One step higher than that is when we talk about prevention of disease. That's a little bit better, where you may wash your hands because of a virus. You may hide and stay home. That's preventing your exposure to virus, right? That's good. Prevention. But what no one really talks about is the promotion of health. And that's where we need to live if you want to live a better life. Whether you're dealing with fatigue right now, or you're dealing with low back pain, or your mom has an ulcer, or your brother has chronic fatigue, we're missing the most important component, which is the promotion of health. So looking at the treatment of symptoms, the mindset is add in a drug or take out a tissue. That's kind of the mindset I was mentioning to you, and that's the treatment of symptoms. Is the question is, what synthetic drug can I put in, or what tissue do I have to take out? That's the thought. So that's the question. You're never going to find magnesium deficiency because you're not asking the right question. Prevention of disease is asking, what should I avoid? Don't go eat fast food. You're preventing disease. Avoid people with viruses. Stay at home. That's prevention. Those are all okay things to do. But the promotion of health is you want to ask the question, what does the body need? So when I looked at Josh, I was trying to find out what was blocking his body's ability to heal itself. That's the question I asked. Well, he has a misaligned bone in his spine, pinching nerves. That's going to block his ability to heal himself. Because you have to understand, no doctor heals. The healing all comes from within. So when we look at things like the ocean, and we look at there's salt in the ocean, right? Do you think there's a big variable of salt in the ocean? 10% salt in one area, 2%? It can vary a little bit right at the port of where it comes in the streams and rivers, the blackish water, but as general in the ocean. Is there a big difference in the ratio of salt? What about your fish tank? In a beautiful saltwater fish tank like this, do you think you can have a wide range of how much salt is in the tank? You need 3.5% of salt in the water. If you go to 5%, the fish will die. If you go to 1%, the fish will die. You need an exact, precise amount of salt in the fish tank. When you look at your bloodstream, you've probably heard of pH, like that's like being acidic. You've probably heard of that, or alkaline. You learn that in chemistry class, is acid, acidic, and basic. What should the pH of your blood be? It's got to be exactly between 7.35 to 7.45. What if it goes to just 7, like just off just a little bit? You'll die. If it goes off just 0.3 of a point. So the precision in nature of what you need inside the body to work is finite. It's precise. It's very, very accurate. When we look at the human body, doctors are not asking the question about what levels of the needed ingredients are inside the body, because the body's self-healing. I have to figure out what it needs to do its job. I took no credit for Joshua's health. It was his body. I was overly excited. I couldn't sleep at night. I was giving him high fives and hugs, but I didn't take credit for the healing, because the healing came from within his body. So when we look at the human body, the amazing creation of the human body, we have to find out, what does it need? And unfortunately, if we look at our car and our car breaks down, we don't just grab an extra car part and say, let me just take a Ferrari tube and stick it in this hatchback Toyota and see what happens. Let me grab some other fluid from another car and just let me try to stick something in the car. You don't do that. You figure out what the car needs. Maybe a little more oil. Maybe the filter's clogged. Maybe the air in the tires. But you're not trying to take apart the car or just decide it doesn't need a carburetor and pull it out and throw it away. But that's how we treat the human body. If you look at your dog that's laying, you get home from work and your dog's sick and he's in the corner, you're not going to say, what drug do I give him? You're going to want to know, did he get injured, right? Maybe his spine or his paw or something hurt him. And then you're going to see, I wonder what he ate. Maybe he ate the plant in the living room. You're going to ask what went in the body or what trauma was on the body. You're not going to just stick a drug in or take an organ out. But we have the lowest respect for the human body. In fact, your body, because we're not asking the right questions. If you look at a plant that's in the window and you say the plant's wilting, you're not going to give a drug or cut the plant at its base or rip all the roots out. You're going to say it needs a little more light or a little less light or a little more water or a little less water. You're trying to create balance and equilibrium so the plant can flourish in its own right. So we look at minerals and nutrients inside the body. It's very interesting that your body needs micro amounts of nutrients like the salt in the ocean, like the minerals in your body. So iron in your body, you only need this much iron in your body, 4 milligrams. It's a tiny amount. What if it was only 3 milligrams? You couldn't make blood cells. You'd have a thyroid disorder. You'd have major depression. You'd be exposed to disease. You'd have chronic fatigue. You'd have hormone imbalance. Just 1 milligram less of that mineral. So this is the kind of things that you would see: extreme fatigue, weakness, pale skin, chest pain, fast heart rates, headaches, dizziness, cold hands and feet, inflammation, brittle nails. But if you didn't think of the body can heal itself, but it's deficient, you're going to take caffeine for the fatigue and the weakness. You're going to take something for the pale skin, another drug for the chest pain, another drug for the headache, another drug, and you're going to try to figure out. You're going to say to yourself, the body doesn't work. It's broken. How can I make it unbroken?
Yeah.
That's the wrong premise. So the same thing for magnesium here. If your body needs a little more magnesium, it needs 25 milligrams of magnesium. Half of it's in your bone and the rest is in your body. Magnesium is responsible for 300 jobs in your body. I don't know about you, but I've had 3 jobs at one time, and that's a lot of work. This mineral has 300 jobs in your body. So imagine being deficient in just this one mineral that has 300 jobs in your body. So if you don't have magnesium, you can have twitching like Josh did, muscle twitching, mental disorders. If you ask Josh, was he clear-headed during that time? Or was he foggy and cloudy and confused and irritable and all of that? Yes. Osteoporosis, you'll have weak bones, fatigue. Did Josh have fatigue? Yes. Your blood pressure go up. You can have breathing problems. You can have irregular heart rates. So what we can do is we can match those to drugs. If we feel the body doesn't work, we'll take this one and match a muscle relaxer. The mental disorder, give an antidepressant. Osteoporosis will give osteoporosis drugs. Fatigue, let's just load up on the caffeine. High blood pressure, beta blockers. Asthma, we'll give an inhaler. Now you're over-medicated, 10 times more sick, and you don't know what's going on. But how exciting is it that you could just give one simple mineral a couple of milligrams and solve all the problems at the same time? So in conclusion of the talk is I want you to feel inspired and I want you to be empowered, that you don't allow a doctor or your family or anyone to focus solely on the treatment of symptom, because that's an empty prize. You have to focus on not even the prevention of disease, that's okay, but you got to focus on the promotion of health. So in closing, my goal and what I do is I'm looking at all the micronutrients and even the macronutrients. Magnesium is actually a macronutrient because it requires a lot more, but things like protein, fit omega-3 oils, all the vitamins, these are the things that we start with. So before we cut with a knife or put in a drug, we give your body the nutrients it needs to function optimally. And then we can start making decisions. You should never put a drug in your body before you balance the micronutrients in your body that's needed to function optimally. Never do a drug first. The company we founded is called Esiva. It's a company that's based on clinically inspired nutrition, looking at how the body needs to heal. And our goal and our purpose for the company is to help people live their potential. So I'll open up for questions.
Let me just quickly say something. Can you share your story about what really motivated you? You know, you shared some of those stories with me, and which will touch me. How you know, I've known you for a while, and I know how passionate you are about dealing with situations that nobody else can deal with. And you have had so much success. You actually have 30 chiropractic franchise clinics, over 30 in the US. And you are replicating doctors. And part of your goal is that you want cases that they've gone everywhere else and nobody has been able to answer, find solution. You want that you will be the, you know, you will find solution to that. And that was what you did with Joshua. And Joshua is just one of those that you've worked with. Now, you shared with me why you decided to do that. And then you also talked maybe briefly, because we are almost running out of time to be able to take questions. So maybe in 1 minute, and just, you know, your story with your dad, you know, what is motivating you?
So in medicine, in order to make money with medicine, you have to legally create a patent on a drug. So you can't take something like vitamin C and create a patent on it because it's natural. So what you have to do is you have to take a nutrient, like this is a little capsule here. You take a little nutrient and you change it, the inside, the chemistry of it, so it's synthetic. And then you can patent this and you could sell this as a drug and make a lot of money. Unfortunately, in medicine, they've taken a lot of nutrients and they won't sell them. They have to alter them so they can put a patent on it and sell it. So my father was given a drug for a period of time that always made his lungs weak and his kidneys have issues. And he had a hard time going up a flight of stairs. So when I came to visit, I got him off all the medications and he was running up the stairs. So too many times a drug that you take will fix one organ and cause another one to fail. That's not health. Every doctor specialist is focused on only their organ. The cardiologist is focused on the heart. If you have kidney failure, he still gets an A+. He's only focused on his one organ, and that's what he's rated on. So specialists can be scary unless you're in an emergency situation. You have to be careful. So my father was given this drug that was causing kidney failure and lung failure, and I got him off all the drugs, and he was really healthy. He had another arrhythmia in his heart. And I told my father to ask his doctor about magnesium because it's very important. And the doctor said to my father, he says, ask your son if he even knows what side the heart is on.
Wow. God.
Because I brought up magnesium. Well, he went in the hospital again for that arrhythmia, and the doctor sticks a needle in his arm and puts that same drug that he was taking by mouth, a drip of it, a lot of it. And I ran downstairs, I called my sister, and I said, can you pull research on that drug one more time? And she says out of 100 rats, it caused like 90% had kidney failure and lung failure. And I'm like, we got to stop. So I run upstairs, open the door, and he just died after that injection, about 30 seconds.
Wow.
So,
Wow.
so I didn't do an autopsy, and I didn't, you know, I almost did bad things to that doctor. But I decided to hold that anger inside to have a mission to help other people so they would never have a family member die prematurely from medication.
Wow. And you know, your story is similar to my story with my mom. I don't really like talking about that, but I know that, you know, we need to really, as you said, look more within and allow our bodies to fight the battle. Thank you so much. I'm going to allow you still doing the roundup. I know you have something for us that, you know, you want to give to us, you know, especially for those in Nigeria. And I'll give you about 2 minutes after we answer some of these questions to talk about it as we round up. I have a lot of questions here. I have a testimony. One person says, I'm a living testimony of taking magnesium. That is Bonjubola Sonny. Hi, Bonju, how are you? He says, I'm a living testimony of taking magnesium. I had heavy bleeding for years. I was almost taking out my uterus. By, you know, doctors wanted to take out her uterus until she met Dr. Sam. We had Dr. Sam about 3 weeks ago come in to talk to us, and he told me to take magnesium and so and some other supplements, and her story is different now, you know, that she's a changed person just by correcting the imbalance in her body. And before then, she was going from hospital to hospital and on so many medications, and nothing happened. Another question is, would you recommend topical card products as a holistic? I don't know what that is. Topical CBD.
What kind of CBD?
It said topical.
Topical CBD.
Topical CBD.
Yeah, topical CBD has some proposed relief for joint pain. I think the oral is the best way to go because you got obviously more absorption. You got to be careful of CBD of how it's processed to make sure that it absorbs. I'm going to show you something real quick. 1 second here. I'm excited because after like 18 months of testing, we finally have our CBD oil is ready to go live. So we've been through a lot of work to test. But yes, you have to be careful that it's processed with a CO2 extraction, not ethanol, to make sure that it works correctly.
And I like, you know, one of the things that I'm really attracted to what you do was the fact that it's not your products. You know, when I saw the products, it wasn't about producing products, but, you know, getting for your patient the best in the market, the best out there to get the result you want. And you shared with me that the reason why you went into producing Asiva was because when you were working with your patient for the micronutrients and macronutrients, the things you were getting on the shelf wasn't getting you the result. Many of them were contaminated or mixed with fillers. And so you said you actually started producing things in your garage to be able to, because you also have a diploma in you're a chiropractor, you have a diploma in clinical nutrition. So, and then you have this large experience with clinical nutrition. And so it was because of your patient, you started producing, compounding, and you were getting such amazing results. And that was actually what gave birth to Asiva. And so for me, that was exciting because it wasn't about, oh, let's just produce one thing, supplement here, but because you were getting the result. Now, some people have this question, which is also important because this is what we do here. We try to give people, you know, talk about all the different options. And you know, somebody asked, what are natural sources of magnesium? I know that, you know, for prevention, you know, it's important for us to be able to assess that. But for people that are already deficient, they might need a supplement to take them up. you know, just like I take some supplements myself in areas of deficiency, but also for those that just want to know the natural sources of, so that they put it as part of their diet every day. Can you tell us some of that?
Yes, some of the good sources of magnesium, if you want to know food sources. Cashews are very high in magnesium. So a number of nuts. And I had a food chart here. I'm going to see if I can grab that on the list of the highest magnesium on my chart here. I'll pull this up. But you have to realize that if you're very deficient, like Joshua's, you couldn't eat enough nuts, wheat germ, or any of the foods to,
we know that, yes,
offset that deficiency. But it is smart to have, it is good to have foods with it. But when you're really deficient, you probably won't make it happen with just the food itself. So let me see here. Yeah, it's pumpkin seeds is another one that's really high. Almonds, spinach, cashews, roasted peanuts. So those are some of the higher ones.
It's so interesting. It's just that we are living life that we are not really in tune with nature anymore, because all this that you have mentioned are all over the place. Yes. So we shouldn't actually be deficient in magnesium, but most times we are just eating one particular food because we are so busy. And so you rush, you just take this biscuit, you take this thing, and so you're not eating a variety of food to be able to give you what you need. Somebody else asks, what nutrients are best for thyroid issues?
Thyroid issues, the main cause of thyroid issues, it's really an autoimmune disease about 90% of the time. So it's not really a thyroid problem, it's an immune problem. And so most doctors just give you a thyroid drug right away, but that's not really the cause. It's a little more complex because you have to heal the gut so that the thyroid works. So I know it's confusing. You got to give the right nutrients. If I was to just say what nutrients, I would say vitamin D is very crucial. And then herbs to support the liver, because some of the hormone is made in the liver. It's produced here in the thyroid, and then it's converted in the liver, and it's converted in the gut. So that's important to take. I would say vitamin D and fish oils are very important, and things that support the liver, like milk thistle, would be great. We have a product called CT Reg that's for cholesterol and thyroid issues. CT for cholesterol regulation and thyroid regulation. It has all the nutrients to help the thyroid function better.
I think this is the good time for me to talk about something we are working on. It's called WAM, Wellness Advocate Movement. And I'm excited about that because with this Destiny Talk series, that is just 1 hour or 1 hour, you know, if we go over it a bit, we are not able to really do what we want to do. You know what our goal is? Our goal is to make every layperson able to teach, understand about health, and able to teach his neighbor about health. And that's our goal, you know. And so to do that, we can't do that with this 1 hour program. So we have a movement called Wellness Advocate Movement, where you can register and attend a regular training that you get a lot more information on some of these things, on how to help yourself and how to be able to help your neighbor, because that is really our goal, you know, that just like Dr. Joe said, nobody should die prematurely, you know, from things that they can prevent. So look out for the Wellness Advocate Movement registration. If you want to be part of it, it takes commitment. You have to work hard. It's not just going to be easy. But if you truly want to learn about health in a very simplistic way, and, you know, learn how to help your body in order for your body to heal from within, do what your body needs to do, then Wellness Advocate Movement will be yours. Well, should be where you need to be. Somebody said, and I'm going to take just 2 more and then we will close. What natural remedy will you recommend for someone that has regular fast breathing and constant cold?
Fast breathing and constantly cold.
That is tachycardia.
Yeah, so fast breathing, if you're regularly cold, it's usually a thyroid issue. But that's a little complex because a thyroid problem wouldn't make you fast breathing; it'd slow you down a little bit. So I'd have to know more about it. But the cold all the time is usually a thyroid issue, and the fast breathing could be a breathing issue like asthma. For both of those conditions, the same thing: vitamin D and fish oil will help. Will help that. If it's breathing issues, magnesium relaxes the lungs, so the airway opens so you can breathe deeper. So for that case, without diagnosing, I would say magnesium, fish oil, and vitamin D would be great.
Somebody said something, and that is very true. Somebody said, Mr. Ayomide is here on the chat, and he's saying that people should not worry. There will be no more self-medication because you are going to be in Nigeria soon. And so, yeah, so we are bringing Dr. Joe. We're actually bringing his clinic down to Nigeria. And so look out for that within the next couple of months. And we are going to be, we want to be able to help people live healthy. I think I'm going to combine one last question is, somebody said this, he said, need help to better regulate my thyroid level. I've been on levothyroxine for years, but not seeing my levels but not sure my levels are optimal. For some of you, some of these things are personal that we might just say, afterwards, we can arrange for Dr. Joe to consult. Is that okay, Dr. Joe?
Yeah, we actually have a team now of doctors that we're deploying around the world who are doing lab evaluations in a nutritional stance versus a medical stance. So you can get lab drawn through our system now anywhere in the world. We just have to have a relationship with the lab local, and we'll have experts, doctors who are specialized for over 25 years in how to use nutrition to solve your labs, your thyroid and your other issues without having to go down heavy medication route. So we're excited to do that in Nigeria. And Dr. K, we haven't talked about this, but it's just launching here in the US, and it's getting massive traction,
Wonderful. I have somebody from Lagos government. I'm not sure the name, but the person is saying, thank you so much, Dr. Joe. And then can you quickly talk about, somebody talked about sickle cell anemia. What can help with sickle cell anemia? And oh my, we've run out of time. Do you want to say just one word and then join our wellness advocate movement, and you will be able to get more information on that?
Yeah, sickle cell is not my specialty. It is a genetic disorder, so it causes alterations in the bloodstream. So we want to just maximize the function of the cells with things like vitamin C, keeping the airways open with nitric oxide, and doing good things to increase cardiovascular function. But that would be kind of a nutritional route.
Yes. So I think what I want to say here is we try as much as possible to avoid giving people that, treatment on this program because, individuals are different. So we will say that for some of these things, just reach out. You can reach out to me. You can reach out to us. And then we can, I can link you with one of the doctors for online consultation, and so that you can get the best answer. Before we go, Dr. Joe, you have something quickly for us, and then we show the last slide. Please make sure, don't leave yet. We show the last slide with all the information that you need. And then somebody asked about the wellness advocate movement. Please, on the chat box, there will be a link. There'll be a link to registration. Please check the chat box for a link to registration. Yes.
Yeah, so we're planning on coming to Nigeria and putting these clinics that solve these problems for Nigerians all throughout Nigeria is our goal, and bringing the products that we use in over 150 clinics throughout the US, in the UK, and we're branching into Australia in January. So we're going to be bringing the highest grade nutrients and chiropractic process to the Nigerian people. In order to do that, we want to start building relationships and helping people to inspire them in health virtually before we come to Nigeria. So one of the things we wanted to do, and thank Dr. K and her group for coming up with an agreement to allow you to get these high-end nutrients to Nigeria. We've regulated the shipping over there to cut costs. There's a lot of work behind the scenes to get these products to Nigeria. But the website, if you're interested, is esiva.com, and use the coupon code DREK. The shipments will go back out every like 10 days from the US, so have a little patience on the shipping, but we're doing that to reduce your costs. For those of you who want to start with just the baseline nutrients I talked about, all the B vitamins, the magnesium, the calcium, all the minerals, the whole baseline, so you know that your body's giving at least the micronutrients. It's called Daily Balance. It creates daily balance for your body of all the micronutrients you need. So that would be a start. Josh has it right there. Also, as general nutrients, vitamin D and fish oil will help so many conditions out there. It's a wellness-based product. If you have questions, I don't have it on the slide, but we have a team of people that are ready to support Nigeria. And that's at support@esiva.com. So just put support@ and then esiva.com, and you can ask questions to my team of PhDs and dietitians and nutritionists that want to support your questions. Again, we can't give diagnosis. We're not treating disease. We're giving some general guidelines on nutrients to help support your health. If you want detailed consult, it would require a lab test, local, and one of our specialists to interpret it, and then we can get very precise on what you need. So in closing, I just want to thank everyone. Thank Josh for the opportunity to assist in his health. Thank Dr. K for the opportunity to come to Nigeria and the whole Nigerian team that I know and love from my trip out there. I'm excited to come back someday and continue.
Oh, you're coming back soon. For those that joined, Dr. Joe was in Nigeria last year doing our wellness conference. So please, can you, Dr. Joe, can you stop your PowerPoint? Let's just have the final slide for the information session for those. Thank you so much, Dr. Joe. Please remember the Wellness Advocate Movement. Remember to go to his website. He has agreed, we really talked to him. He has agreed that for Nigeria, it will give us a 50% discount on his products. And so you need information about that. You can email us, and all our information, the coupon code is DREK, and but you can also email us for more information about, you know, how that, the shipping and all of that. And then for those that want to consult with Dr. Joe, please, because somebody says I'm in the US here and I would like to consult with him, just reach out to our email. You will see it at the end, please.
Who can melt the hardest heart and speak life into my soul? And who can spin the world around and hold me ever close? And who can search the depths of me and love me to the core? And who controls the world I see and walks me through it all?